When you have an eating disorder, it isn't vanity, and it isn't a choice. Just like you don't choose to have cancer, or heart disease, or asthma. An eating disorder is a deadly illness that can strike anyone. It isn't picky about race or gender. It doesn't care where you live, how much money you have, what you weigh, or how supportive your parents are. And it isn't just about food. 97% of people with eating disorders also have depression, mood, anxiety, substance use, or other disorders. In the United States, more than 30 million people are suffering from an eating disorder, and those are just the ones we know about, because only 1 in 10 seek treatment, and of those, only 35% go to a facility designed to treat these complicated diseases. A shockingly low number when you consider that eating disorders have the highest death rate of any mental illness. We desperately need to get more people who are suffering the specialized care they need and on the path to lasting recovery. Our best chance of saving lives is to get loved ones into treatment as early as possible.
Since I was 17 to the present day, I've really struggled with my eating disorder. I would wake up every morning and tell myself today is going to be different. Then as the day progressed, I would end up taking a lot of diet pills, sometimes 4 or 5 times the amount of, recommended dosage. I knew things were getting out of control when I didn't want to get out of bed anymore. I didn't want to be with people. If the eating disorder didn't kill me, I was going to end up killing myself. I was disgusted with what I hadn't done yet, and I didn't want to be with myself. I remember writing a note as I had my suicide attempt, and I said, I'm sorry, this will be the last mistake that I ever make. The first time that I knew I was really ready to recover from my eating disorder was when I went to ERC. All I had was a little bit of willingness to trust people. I have really, with the help of ERC, been able to find what I value, the things that I hold dear. I'm learning to love life. I'm engaged in my family's life. I have more than the eating disorder could ever give to me.
There is no question in my mind that on a daily basis, we save lives. What allows us to do that more successfully than anyone else in the country is our medical and psychiatric expertise. It's really, really, really important to me that the integrity, that the excellence of who we are and what we do is never compromised.
Much of the mortality that we see in eating disorders is a direct result of the medical complications that occur.
The irrationality of the behaviors is what has a tendency to exhaust the families.
Our son Cole was diagnosed with anorexia nervosa at the age of 12.
Cole mentioned his behaviors with restricting food and purging. The therapist that we brought him to said we really needed to seek professional help in the world of eating disorders.
Cole was at that point very much resisting treatment. Eating disorders are incredibly manipulative in the minds of a child that has one. But the sicker he got and the more difficult it was to handle his illness, we had to listen to what the experts were saying. And once we put that trust in Eating Recovery Center, the game changed because all of a sudden Cole and his eating disorder were no longer in control.
It's every tool, every technique that helps you as a non-medical professional. And I firmly believe that that contributed greatly to Cole's path to recovery.
Because Cole's brain is healed, he's moved on. He sees himself as a healthy, active teenage boy.
I think as parents and also as a family unit, we created our new normal.
I know it's so difficult not to get caught up in feeling like you're the blame for everything that has happened in your child's life. You're not the problem, you're part of the solution. And we're here to give you the tools that you need to be the very best parent that is possible.
When families often say, I want my child back, you don't. You want the new and improved version, the one that matured through this experience. And to see that, to see a life sort of, in many ways, to take the burden of this disease turned over and actually use as a stepping stone to move forward in life.
When I was hospitalized, I was so sick that no other place would take me. I was in liver failure, heart failure, kidney failure, my lung collapsed. I was on a feeding tube, couldn't walk, but the eating disorder was so important to me that, restricting was still what I felt I needed to do.
I had reached out to ERC hoping for a miracle. I really was hoping for a miracle, and I got my miracle.
Anyone would make extra time for me if I needed it. I mean, they treated me like I was their own daughter, which meant so much to me and really helped me during those tough times. It was like they had become a second family to me since my family was unfortunately so far away. I was like, I don't want to live this life anymore. I want to be with my friends. I want to start dating. I want to go to college. Now I'm actually a licensed social worker, and I actually am working with clients who are struggling with eating disorders.
In anorexia and bulimia, really no patient should feel like they're out of medical options.
We treat the entire spectrum of eating disorders, from the most severe to people with minor difficulties with eating disorders.
It's communicating to the patient that we understand what it is that they're struggling with, and that we believe that we have an alternative way for them to try to feel safe or to feel in control of themselves.
I feel like my story, or I'd like to think that my story brings hope and identification. Oh, look, Robin did that. Maybe there is hope for me. Maybe I'm not my eating disorder.
Based in Denver, Colorado, Eating Recovery Center's family of facilities has comprehensive treatment programs supporting patients nationwide. Specializing in the treatment of eating and related disorders, the Eating Recovery Center system can pull research and resources from their network at any time, so that even the most extreme cases receive the critical care they need. Teams of medical doctors, nurses, psychologists, therapists, and registered dietitians collaborate with the patient's home care team to ensure a seamless transition for the patient and their family, and to give patients the best circumstances for lasting recovery. It is the mission of Eating Recovery Center and their partner programs to have all patients live a full and recovered life.
Recover freedom.
Recover connection.
Recover health.
Recover living.
Recover values.
Recover fire.
Recover joy.
Recover meaning.
Recover family.
Recover hope.
Recover life.
Eating disorders are a serious behavioral and mental disease. It is important to seek help from medical experts immediately if you or a loved one is suffering.